Hello, I'm Curt Goering, Executive Director of the Center for Victims of Torture. It's great to be here today to share with you this third video conversation in the lead up to the October 7 Restoring Hope breakfast. Looking back on what CVT has done this past year, it's so clear that it would not have been possible without you, your belief in this important work, and your support. For 3.5 years, the Trump administration has carried out a relentless assault on refugees and asylum seekers, dismantling the asylum system piece by piece. These cruel actions have left already highly vulnerable people stranded in makeshift towns and refugee camps at the border. Many asylum seekers have been forced to make the heartbreaking decision to send their children across the border without them, since they may have a better chance of seeking asylum than adults. As we saw this crisis unfolding, we knew we had to do something. So, with support from donors like you, who also felt we had to do something, we launched into action to respond. Carlos Aceves, a clinical advisor for CVT, is on the team leading these efforts. Carlos, welcome. And can you tell us, what were some of the first steps the team took to figure out how to provide care at the border?
Thank you, Curt. Well, the first thing that we did was to conduct an assessment along the border. So we visit places such as Tijuana, San Diego, Juarez, El Paso. And then, well, unfortunately, that's when COVID hit the border. And so we had to conduct the rest of the interviews remotely, moving west to east. What we did was conducted in the meetings with those working in the front lines in the field of the border crisis. So we met with immigration attorneys, with shelter staff, with universities, with nonprofit advocacy organizations, and with health service providers. What we did was to ask people about their work and the needs of the asylum seekers along the border and the challenges doing this work. One thing that we heard that really sums up the experience is that there has always been a deterrence policy in Mexico and in the US, but in the case of the US, they have added cruelty to that policy. The assessment largely confirmed that what we expected, that there's, although there's very good service providers, the mental health needs of the asylum seekers still grants for mental health care in this, with this population. And then also that it would be very good to have support for the service providers at the border. And that also would be very good, very useful to have psychological evaluations for the asylum seekers to have another basis for the legal, for the asylum claims in the legal system.
Very interesting. Carlos, it really is easy to feel like what's happening at the border is completely hopeless. But just hearing about your visits, and as you've been talking, about the visits to these border cities, it's clear that you did find hope that things can get better and there are things that can be done. So now that we know these 3 areas of work that also intersect with CVT's work, what are the next steps?
Well, as I said, we met with many legal service providers that work really tirelessly with asylum seekers. But actually, I think they're exposed to many traumatic experiences that might have an effect to their health and to their work. So one of the first steps that we want to take, the next step, would be to have secondary trauma training and support for these legal professionals who are in the urgent need of that assistance that goes beyond the basics, that goes into a more professionalized and nuanced care for them. And so what they're experiencing is very consuming workloads, and then full of families completely vulnerable as they escape these horrifying situations in their home countries. So these legal service providers are some of the best hope that we have at the border, and that they have to reach safely into the United States. And CVT has the expertise to help sustain the work of these professionals and to prevent secondary trauma, and to have a trauma-informed lawyering aspect to their work. We received some initial startup, and then to support to implement this project, first in San Diego, and then going across the border to the Rio Grande Valley, where tens of thousands of asylum seekers languish in very low resource communities.
Thank you, Carlos, for giving us hope for a situation that can sometimes feel so hopeless. And thank you. CVT is committed to responding as swiftly and as forcefully as possible to these attacks on asylum seekers and refugees in our country. But we are only able to be nimble and responsive, to build new programs like the ones Carlos just told you about for the legal providers, with the compassionate and generous support of supporters like you. Thank you again, and we'll see you on October 7th at the Restoring Hope Breakfast.